Hello, Eitan Shalom at the Body Mind Wellness Center. I want to show you what I'm doing with this patient. He has an ongoing chronic painful situation in his possibly rib attachment, but it may also be a trigger point in one of the rhomboid attachments. And I've done both dry needling and electrical stimulation. And so you can see here that I'm going to remove the clip from the electrical stimulation. You can see this is the epicenter of his problem right here. I'm going to actually adjust the camera for a second. It'll be blurry. So right there you see where I've marked with the surgical marker, and that's where he feels the pain and chronically, and it's very difficult for him to stretch it. And there are some cupping marks on his skin. That's why his skin looks discolored there. That's from a previous visit with someone else. And you'll see that I have attached this clip to this point, which is the head of the rib. And oh, I need two hands to get that off. I'm going to leave it on. So when I needled this head of the rib cage, the muscle fasciculated or jumped, it released. And what I've done here is I've needled the intervertebral spaces between each of these thoracic vertebrae to try to loosen up the whole area. Because when someone has a tight muscle in one place, the muscles doesn't mean they only have that tight muscles. The muscles work as teams. So when one team member is stressed out, it'll affect the other team members. And so I've needled these paravertebral spaces. I've needled the intervertebral spaces between the spinous processes of T5, 6, and 7. And then also the paravertebral muscles, the little small muscles that attach bone to bone. Because when those are tight, that's going to affect the rib attachment. And then this clip is attached to the rib attachment. And let me sit down. And then I have done some dry needling in the rhomboids. That's where these markers are. And he also has a very tight scapula, so I've done the infraspinatus anterior. And then I've also done the upper trapezius bilaterally on both sides, and the infraspinatus on the other rib. And then because he's got a lot of general tightness here, and it's related to what we call the liver chi in Chinese medicine, I've done the liver, gallbladder, and spleen back regulating points. And so this is how I'm combining acupuncture with dry needling, because I'm treating the whole person. And his chronic muscle problem, he identified that it's not related to athletics. He surfs, that he doesn't feel like it's sports related. It's because also the other thing is that when he has pain here, he feels pain in the front of his body. And what's interesting is where he feels it is in the area that's related to the liver chi in Chinese medicine. So the electrical stim, I'm using an American-made Pantheon Research electrical stimulator. And I'm not plugging it, I'm just showing it to you. And so when you have the electrical stim, so here's running along these two muscles here, and I'm going to turn it up a bit. So what you'll see is the muscle actually fasciculating, because muscles they work because of electricity, and that's how they work, and they work by shortening. So when in cases like this where the muscle is really locked up and very tight, I like to use electrical stim sometimes, especially in patients that tolerate more strong needling. And that's to basically exhaust the muscle into letting go, into relaxing. And I did have this attached to that main point. So what I'm going to do now is I'm going to take his needles out, and I'm going to do some strong cupping right over that point that he identifies as the source of the pain. And then I'll take the needles out and turn him over, and I'm going to do some of the front acupuncture points for what we call the liver chi, which is related to the kind of stress energy that you feel when you're under pressure or frustrated. Thanks for tuning in, and be sure to like the video, and feel free to subscribe and comment if you have anything to say or ask. Thank you.